I'm going to say something controversial. I recently heard an online TRT doctor claim that any man can have low testosterone. Technically, that is true. Any man can have low testosterone. In reality, however, only a relatively small proportion of men do, irrespective of age. In my view, testosterone deficiency is both overdiagnosed and underdiagnosed. It's often overdiagnosed in the men least likely to have it and overlooked in men most likely to benefit from testing. Overdiagnosis is frequently driven by poor testing practices, particularly from companies whose business model depends on finding a reason to sell you testosterone. Levels should usually be checked in the morning while fasting, and a diagnosis should not be made from one isolated result. The men at greatest risk include those living with chronic illness, overweight or obesity, diabetes, metabolic syndrome, or those taking medications such as opioids and some antidepressants. Yet testosterone deficiency is often missed precisely in these groups. The men at lower risk are generally fit, muscular men without significant health problems, unless they have previously used testosterone or anabolic steroids, which can suppress the body's own natural production. Across Europe, low testosterone affects around 8 to 10% of middle-aged and older men, and the prevalence increases with age. That figure becomes lower when diagnosis requires both consistently low levels and symptoms of androgen deficiency. Around 75% of men maintain normal testosterone levels into old age. So yes, any man can have low testosterone. That does not mean every tired 45-year-old with an Instagram account needs twice weekly injections.